Okay, thank you, doctor. Let's see. After 10 days, those two positive right now that are in quarantine or being isolated, after 10 days, they're going to be released back to the community? I think that's how it's going to be?
Yeah, so CDC has done a lot of studies on how long people are infectious after they've been infected with the name of the virus that causes COVID-19 is SARS-CoV-2. So when you have that virus, whether it's a Delta variant or Alpha variant, they're looking at how long you're infectious. And currently, the science says that after 10 days of having symptoms, or if you don't have symptoms from that first test result, as long as you're feeling better by those 10 days, your body has fought the virus and you're no longer infectious. And in fact, in the United States, many times, or most of the time, people are released after 10 days. And they've looked at those people after they go into the community, are they a risk to the community? And they haven't found evidence of future spread of COVID-19 from somebody that's been isolated appropriately for 10 days. I understand that the Ministry of Health here in Palau, to add an extra layer of confidence, will be testing these people after 10 days to also see if their test is negative before they're released as well. But from CDC, it's 10 days. Now, just so folks know, because I hope people are going to the cdc.gov website to look for information on COVID-19. That's probably the best place to look for really, there's a lot of misinformation out there, and CDC website has good information based on the science. You will find that for some individuals, CDC says, hey, you want to push it out for 20 days of isolation. But those are people that have poor immune systems and are sick in like intensive care and really sick for a long time. And they say those people whose bodies aren't strong enough to fight that virus, they recommend 20 days. So if you go to CDC website and are looking up recommendations for isolation, again, as Ghaffar mentioned, and you got correct, for somebody who's infected, they go into isolation. CDC recommends 10 days for most people, but there's a small number of people that they would push out for 20 days, but those are people that are really sick in the ICU with immune systems that can't really clear the virus. So, sorry for the long answer, but that's basically they'd be released into the community after 10 days.
Okay, so in other words, you have your message to us is to protect yourself, and the best policy is to wear mask. If you don't know a person that next to you or being in the same room with you, so the policy is the best policy is to go ahead and protect yourself by wearing mask, so you don't get the virus, because some people claim that they have been vaccinated, but yet they still get the virus. So
yeah, a great question. So first off, actually, the best thing that you can do to protect yourself from COVID-19 far and away is getting vaccinated. If you're 12 and over and don't have a contraindication to get vaccinated and you're in Palau, you should go and get vaccinated as soon as possible. It really, the reason why we're afraid of this virus is for some people it can cause severe illness that puts them in the hospital, and it's caused a lot of death. And vaccines are remarkably effective at stopping that. So while it's true, there are some people that are vaccinated and still can get it, it still reduces that chance as well, but is very good at reducing your chance of winding up in the hospital. So first thing, get vaccinated. Once you're vaccinated, you can add these extra layers of protection to make sure that, to help reduce your chance of getting infected. And some of those are, the common things of washing your hands, sanitizing your hands frequently, also wearing a mask if appropriate. And I know that the Ministry of Health has recommended that, people have the option if they feel worried and they want to wear a mask. That can really be helpful at reducing your risk of getting infected, but also really reducing the risk of you infecting somebody else who might be with you. And CDC right now recommends where places where there's transmission. Now, fortunately, Palau, there's no evidence of community transmission at this point, but in places in the rest of the U.S., because there's so much transmission or spread of the virus, they say, hey, if you're indoors with other people, go ahead and wear a mask, because that's where a lot of transmission occurs during indoor settings where people are unmasked and they can spread it to each other. Fortunately, Palau, without the community transmission, there's that option not mandated by Ministry of Health. It's really about...
Okay, excuse me, doctor, can you hold that and let's get this call? Alingil gusto ngay?
Malungil gusto ngay. Sa kalyo kelo assess kung katingilo at
J3.
J3.
Yeah.
Pfizer ngari ang 7 mo nga Pfizer at plato nga J3.
Okay, good question, doctor. The question is, if you already got J3, can you go ahead and get Pfizer or Moderna?
Yeah, a great question. The mix and match question. Well, right now, CDC and FDA recommend that you stick with the vaccine that you got it first. So if you have J3 or the Johnson & Johnson vaccine, they recommend that you don't need mRNA vaccine on top of it at this point. And the reason for that is, as you know, CDC and FDA really want to make sure that these vaccines are two things: safe and effective. You know, that they're safe for people to get and they work well. And there's not enough evidence yet to really prove that mixing and matching of vaccines are safe. So this might be a recommendation that comes out, way in the future, but at this point, the recommendation is to stick with the vaccine that you have.
Okay, and this is probably going to be annual vaccination, maybe sometimes down the road, the scientists at the CDC say that we're going to be required to get the shots once a year like a regular flu. We don't know yet, but do you think we're going to be required to get, maybe after 12 months, we're required to go and get another Pfizer or Moderna or J3?
Oh, Mr. Diaz, you're very on top of it. Yeah, for sure. So I don't know. We don't know, as you said, we don't know for sure what they're going to say for us, what the requirement will be, if it's every year or what it might be. But one thing that's coming up, and folks may have seen this in the news, there's two things. One is there's going to be additional doses available. The first rollout of additional doses is starting, and it is for people that their immune system didn't really respond well enough to the first two doses, and these are people that have problems with their immune system. So they find an additional third dose helps them. So that's going to be rolled out soon. But also in the future, they are looking at giving what they call a booster dose for other individuals that have been vaccinated. They had a good response initially to the vaccine. Their immune system is really spun up and ready to fight COVID-19, but then it starts to drop off. If they haven't seen the virus, so your immune system starts to slow down, and they look like, you're talking about a year, it looks like going to be 8 months from your last vaccine that you would go ahead and get that booster shot. After this booster, we're not sure if it's going to be every year or what, but I think people can pretty much start to think about, 8 months for my last shot, and that would be all three.
Okay.
Moderna, Pfizer, or J3.
Okay, let's get this call. Ali, ngil gusto ngay?
yang maluwal gusto ngay, amo, tangal goyo yung toktan la sitirgil, malmo seryoso mo tomora ventilation, ngwara, ngwara tomotelan yuing, ngwara chance la survivability.
Okay, kapar ka translate.
So, Mansulang ako Dr. Hancock, the caller is asking for those patients who develop a serious illness or severe disease of COVID-19 that eventually would end up needing to be on ventilators, and he's asking what it looks like, what's the survivability rate, and how long, and maybe to follow on from that, maybe talk about what the therapeutics that we have and the capacity that we have now in the event that we do have cases that progress to that level of severity.
Oh, yeah, that's a tough question, but a good one. And so I think, first off, what they're finding is that individuals who are infected with COVID-19 and develop severe illness and go into the ICU, one of the things that really impacts how long they're in there, whether or not they survive, is whether or not they've been vaccinated. So we understand, one, that vaccination really prevents severe illness, but unfortunately no vaccine is 100%. But not only does it prevent severe illness, but if you're one of those unlucky few that's vaccinated but go into the hospital, you actually have a higher chance of surviving as well. So again, just to go back, being vaccinated is really the first key to protecting yourself from COVID-19. But unfortunately, once people get in the hospital, not a high percentage of them go into ICU or critical care or need to be in the ICU and on a ventilator. But of that small proportion that does, it can be a while. Some folks can be on a ventilator for a long time before they recover. There's a lot of medications that have been developed to fight this virus from the beginning. You know, back in January of 2020, we didn't know how to manage patients well. We didn't learn as much. We didn't have good therapeutics or medicines for them. But there's now some medicines developed to really help increase that survivability. One is a medicine called remdesivir, which is given IV to patients when they're having severe COVID-19 and been shown to help individuals recover. Unfortunately, Palau has received some of this medicine from the United States to have on hand just in case. The other medicines, which are new ones, which are really quite I think really fit well for Palau, are these monoclonal antibodies. And the one that's being used most right now is called REGEN-COV. And these antibodies, it's an IV infusion, so you get it by IV, but it's actually given to you early on before you get really sick. So if you're somebody that's high risk for severe COVID-19, and that can be individuals who are older, people with comorbidities like diabetes or existing lung disease, and let's say you test positive for COVID-19, but you're not that sick yet, because we find people, it takes about 7 days before they really start feeling sick. So early on, if you test positive, you can come to the hospital, and they might set up a different process for doing this if there is more cases in Palau and they need to give a lot of it. But this medicine, you get it before you're really sick, and it actually helps prevent it treats you early before you even have bad symptoms. So even though you're positive, you take it, and it reduces your risk of hospitalization by about 70%. So that's another medication that's available in Palau that the U.S. government has helped supply just in advance in case something happens. And really, it's good that the public knows about its availability if there is, unfortunately, more spread of COVID-19 in Palau.
Okay, let's get this call. Okay, Gabon a caller.
Oh, India, last and final question. Kapar kamuida ika. Keldomesa Trendra Abdul Af, Ogera Toktak. Domesa Trendra Abdul Af American, Afman Mral Murbaba, a Trendra COVID-19 Tair India, ma director Siaval, Vasina, el ager sohal omoger nila Toktang awasi. Kamam Lomesa YouTube material ma a Facebook. Abrula Israel Afman safe. El Alcis. Ayal vaccine. Mal dialog merbuil etemal moit. Emergol tira meva vese uspe. Kam gerila toktang wasin wangara perspektif nila wai gajil. Luguk mama omesel trend rawat kali beraktu wasa Israel mal safe Abdullah.
Mataiwa.
Dim gerila toktang ko man sulak.
Okay. Kaboy kapar.
So Dr. Hancock, the caller is talking about the trends of disease, COVID-19 disease, specifically in the U.S. and how it's rising, and I guess in comparison to other places like India and Japan,
Taiwan,
And then, of course, Israel, he referred to Israel and how well they did with their vaccination. What's your perspective of that and how it coincides with vaccination?
Yeah, that is a fantastic question, and something that we've been looking at very closely. So certainly India, the pattern of transmission in India really sort of looks like an unchecked movement of the virus in the community, that the virus really ran through the community quickly. It was quite devastating for many parts of India. But after, the virus, after you recover, so when you're infected with COVID-19, there's like basically two options. One is you survive it and you recover, and now it's like you're vaccinated. You can't get it again for a while, or you die. And unfortunately, if you die from COVID-19, you can't get it either. So in India, what happened is there was lots of transmission of COVID-19. They didn't have good vaccinations, but eventually the virus slows down and can't cause as many infections. So that's what happened in India. The vaccines really prevent that second option of dying. And so we're seeing in Israel where their vaccines worked very well at first, but with the arrival of the Delta variant, it can transmit a bit more easily than the other variants if you're vaccinated. So the vaccines work amazingly well at not only preventing severe illness and hospitalization and death, but also reducing the ability of you to be infected by the virus. With the Delta variant, it's much more infectious, and it can infect people who have been vaccinated. As we said, no vaccine is 100%, but just want to emphasize, if you're vaccinated, your chance of getting infected is still much lower, even though there's a chance. And they found in Israel that they did see more infections there. Fortunately, their deaths are much lower than the deaths when they had their original surge. So the vaccines did work well in reducing that the severe illness and death. Also in Israel, from the pattern in Israel, is a lot of the evidence for why we're doing these booster shots, because they found that people that were vaccinated much earlier, 8 months earlier, were not as well protected against infection as those that were more recently vaccinated, and hence that's some of that effort for that booster shot that may be coming out late in September. Now, what's happened to the U.S.? So you may know the U.S. had a lot of vaccines, and we unfortunately have not been able to really vaccinate our entire population, our eligible population, like has happened in Palau. And this Delta variant, because it's so infectious, it can really spread, and it has in the U.S., really spread among the unvaccinated. It causes it's causing a lot of severe illness and death, and lots of infections in the U.S., especially in those communities that are unvaccinated. And if you look at the patterns of transmission in the U.S., much of it is occurring in the southeast parts of the U.S., where those states that have the lowest vaccination rates. And so this Delta variant is very good at finding unvaccinated people and infecting them. And so that's what's driving the U.S. numbers despite our vaccination coverage. So Palau is unusual. Palau's got higher vaccination rates than Israel, much higher vaccination rates than the U.S. So you have that key foundation of protection, especially against severe illness, hospitalization, and death, which is what really makes us very scared, made us scared of this virus before. You guys now are well protected against that. So that's the difference between the patterns of transmission. And again, I am not aware of another country in the world that has better vaccination coverage than Palau. I want to say, the Moderna and Pfizer vaccines are showing to be the highest quality vaccines that we have right now against COVID-19. And, fortunately, Palau's been able to get enough of those vaccines from the U.S. government to protect yourselves. Yeah.
Okay. If you have a question and you want to ask, please call 488-4848. But in the meantime, Dr. Hancock, I have 2 or 3 very controversial issues that we would like to ask you if you can answer them. Okay, let's take this call. Aliw ngil ko sa ngay.
Oh, iya stop Crystal. Kasi ako ba? Mula ko cell 3 eh.
Okay.
Udah 6 months lalu kan. Muadil dari ka tapi kira aku kusuhan.
Okay.
Saya kan baru saya booster.
Okay, come to let's get clear question. I say going ilu a shot to find out to la sexual. Dito kam help pranalo res nilenggang ngel.
Hindi ang wase al sugo mangilo kung da swari ra al sugo mangilo chay 3 awe pa elol malbuile ang mamtigar ngil waseng sukal. Oo, ang sapel ngwa taray kelorus or sa el ngwa booster. Kapar amoy din motora.
So the caller asked he probably had taken J3 and perhaps 6 months down the road he's diabetes or some other form of chronic disease. Will he still be eligible to get a booster if a booster is recommended for J3?
Yeah, so he should be able to get that booster. The contraindications for J3 are quite limited. So even if something develops, unless it's, generally I think the main contraindication for J3, meaning you should not get it at all, is if you had the dose before and you went into severe allergic reactions to the shot. But otherwise, you would be able to get the second dose. Do note for individuals, let's say you did have the J3 and you had a severe reaction, in some of those cases, and we'll see if it turns out with the boosters, if you can switch vaccines, but you should be able to get the J3.
Okay. Dr. Hancock, you're active military, right?
So, yeah, I'm active duty with the U.S. Public Health Service. So,
I see.
Yeah, we're a branch of the uniformed services that not a lot of folks are aware of. But if you look at like the Surgeon General and maybe during the pandemic, you saw a lot of folks that were in blue uniforms. That's us. The Surgeon General is our main admiral for the Public Health Service, and a lot of other of my colleagues at CDC as well as in HHS are active duty officers in the Public Health Service.